Hello and a very warm welcome to this interesting panel discussion on reimagining digital healthcare ecosystem in 2022. My name is Kailash Shirodkar and I am the publisher for Smart Water and Waste World. And I'm extremely excited to moderate this important topic along with my distinguished panel members. Over the next 40 to 45 minutes, we are going to delve into the lessons from the COVID-19 pandemic and how our healthcare sector is trying to create a digital ecosystem that can meet any challenge going forward. To lead the discussion today, I am joined by Dr. Madan Gopal, Senior Consultant Health, Niti Aayog, Government of India, Dr. Shafqat Khan, OSD, Health and Medical Education Department, Union Territory of Jammu and Kashmir, Dr. Neeraj Dhingra, Ex-DDG, NACO, Ministry of Health and Family Welfare, Government of India, and we will also be joined by Dr. Rajesh Harshvardhan, Head Hospital Administration for SGPGI, Lucknow. Now, to begin the discussion today, I would now like to invite Dr. Gopal and Dr. Dhingra first. So, Dr. Gopal, from the digital healthcare ecosystem perspective, what do you think have been the major learnings from the pandemic of the past 2 years?
Which has envisioned that we should be having a digital ecosystem as well as an integrated architecture for rolling out things. Having said this, you see just want to highlight how the journey of this has happened. It's not that the digital mission came out of sudden. We were having some digital initiatives there in the health department, right from the early decades of 2000, and it got escalated from 2011 onwards. Initiatives are there. So Niti Aayog during the year 2018, when the PMJ Ayushman Bharat program were launched, we had published a national health stack, which has resulted in the creation of a national digital blueprint, which ultimately is rolled out as a national digital health mission. In this national digital health mission, as the question you are asking, what has changed during this COVID times? In COVID times, all the things got expedited. You think about previously the digital health, the digital consultations or the teleconsultations were all not looked legally, they were not allowed. Many of the high courts and other things, they have passed orders regarding this teleconsultation, telemedicine. But this was an opportune movement to provide care for the chronic conditions and other things. These telemedicine guidelines were released. And now you have seen how it has evolved. You see how the digital aspects, you see the home care management. Just a small device, tech device that is with the help of a digital thermometer, you can have at least the local people, they have been able to monitor the temperature as well as, and you have seen how home care management, you see the pulse oximeter. These are the digital aids which have happened. Apart from that, you see how the digital things has revolutionized the meetings. Now, previously we used to have Google Hangouts, but now all the meetings like this, they are happening virtually. And now in the day, you can attend 5 and 10 meetings. And during this COVID times, these digital platforms, they have been increasing use. You see the Government of India also has come up with the e-Sanjeevani portal, where the doctor to doctor, the institution consultation, doctor to patient consultation. This has all been leveraged during this time. And subsequently, during last year, the digital mission was rolled out. And now, during this financial year, a budget of 1,600 crores have been earmarked for rolling out of the digital mission for the coming 5 years. That means the roadmap is set. The digital mission will act as a highway in which all the network from the state governments would be joining that network. I will stop here.
So, Dr. Dhingra, maybe you would want to share your experience or views on what you believe have been the major learnings from this pandemic, specifically on online delivery of healthcare services.
Thank you, Dr. Kailash. I think I'll continue from where Dr. Madan left. Let's first understand what Dr. Madan said is that digital or initiation was much before than the pandemic. But the pandemic gives you an opportunity sometimes to fast track many things. With the lockdown, with social distancing, it became important for us to communicate with the others, with the states, the districts, with the PHCs. So what happened is this gave us an opportunity in creating so much of digital know-how which was already existing in the country, gave it in a practical applications for health systems in India. So that's a major breakthrough. Look, for example, we have immunization programs, but were we monitoring it online like we did in COVID, where we were tracking an individual, a COVID positive individual was being tracked, where patients which were admitted, their details of admissions, outpatients, and everything was given online. So this is very good. Another important aspect that we need to think about is that these learnings, which are so important for the health, facilitated communication sitting from central level to the most peripheral. With having Zoom, with having meetings, Google Meet and others, which came up suddenly. And the best part is, people whom we thought will not be able to use this technology have used it so well. For example, using a handheld device, using your smartphone, the people were able to communicate to the periphery. They were able to send communications. They were able to send things. That's excellent. Another thing, even, we need to think about all this data management which was being done online can be used so good for decision making for a disease. So these are very good examples that can be, and definitely we need to think that what now as COVID is going down, we need to think about it that we do not forget this, but we needed to create it up. Thanks.
So thanks, Dr. Dhingra. So coming to you, Dr. Khan, I think Dr. Dhingra made a very important point here that the digitalization of healthcare services was anyways happening even before COVID. It's just that COVID provided an impetus for a greater adoption for these services. So how are you looking at this technology-based information management systems or these new digital healthcare services? So what's your view on that, sir?
At the outset, I would agree with the other panelists that number one, we were already doing a lot of efforts to create a digital environment in the healthcare systems. And number two is that COVID came for the digital, upliftment as a blessing in disguise. In fact, we have strengthened our digital networks, our virtual, world so strongly that we were able to, the government of India has launched the digital health mission now and included Jammu and Kashmir also. There are two sets of people who work in pandemics. One is the people who are the administrators who have to brainstorm, take decisions, strategic, planning and others. And there is another group of people who are the healthcare workers, the frontline warriors. While the frontline warriors always need the support and the hand-holding of the administrator sitting, I think this term, Jammu and Kashmir, I'll be very specific, took a lead in management of the pandemic in terms of not only the logistical, things we put in, the infrastructure, but the manpower, the handling of the situation was so bright that all the two waves, right from 19 onwards, we were able to very fully take control of the situation in a very effective manner. You will be pleased to know that we have so much of oxygen now available in Jammu and Kashmir. We can well, augment other neighboring states as well. So we are thinking as to what we will do with the oxygen, we have. Number two is the environment we have created, the number of beds. We were very lucky that DRDO came to our rescue immediately, and we had two hospitals, 500-bedded hospital, one in Jammu and one in Srinagar, which was set on a very fast-track basis. And within less than a month, these two hospitals of 500 bedded fitted with CT scan machines were, rolled out in both the places. But, if I overall look at the subject of the matter we are discussing, I think two things which this country has witnessed, which has made a colossal change in the healthcare scenario of this entire country, is number one, the launch of Ayushman Bharat healthcare scheme, health insurance. We know that a lot of people live below poverty line, and are not able to afford healthcare. So number one, Ayushman Bharat. And then in our state, we have introduced the universal healthcare scheme for the entire populace of J&K. The Prime Minister was so kind to the people here that every family is now insured with the insurance sum of 5 lakh ceiling, and without any, there's no riders. Anybody could be enrolled. 5 members, 10 members of the family, irrespective of age, nature, disease, health status, or anything. So that way, Ayushman Bharat and its universal healthcare launching is a huge milestone in the healthcare of the entire country. In fact, I feel that if we take it properly to the rural populace, to the poor, the economically weaker sections of the society and specific groups, we will be able to, augment our healthcare so well. We'll have a private participation. 26,000 hospitals are paneled on our Ayushman Bharat scheme in J&K. And likewise, you will be very happy to know that we are number 2 in terms of e-governance. We've just in a short period of 3 years been able to roll out a e-governance model where our entire system is now e-filing, at the higher level. And we are taking this to the grassroots, to the hospitals. We are developing softwares already. The government agencies are working day in and day out to have a model at the smallest healthcare where we'll have data bank in a longitudinal manner of the health status of the entire population, wherein we can then, carry it forward as envisaged in the National Digital Health Mission. We want a repository of healthcare. We want everyone to be on that repository. We want to, have a health ID, maybe the mobile number of the person or a unique 16-digit ID, which we are just, we have taken in hand, and we are at it, and shortly will be, commencing with the rollout of the digital mission, national digital mission as well. So the answer finally to your question for how we learned is that we were able to create a robust infrastructure. Now we know how to handle disasters, how to handle epidemics, how to handle emergencies. People are trained. We have been able to train a lot of people in emergencies. We were not well versed with emergencies, trust me. There are countries like Philippines where there are emergency medical systems which are much more, advanced. But in India, this time COVID has taught us the lesson, and we have moved in a big way in terms of emergency medicine and disaster management.
So coming back to you, Dr. Dhingra, how do you look at these two situations? The pre-COVID level, how do you look at digital transformation of the healthcare sector then? And now after 2 years of pandemic and the various lessons we have learned, how do you see this sector or this aspect of digital transformation moving forward in the healthcare system?
Sort of digitalization in health was already going on. But with the COVID, this made sudden increase, you should say burst of digital health technology took place. The thing is that we need to learn that how this technology was used during COVID times very successfully. And when now we are in a phase where COVID is nearly going down, this technology needs to be transferred to other diseases. Example, there are many diseases in India where management follow-up, treatments, all have to be followed up. Can we use these digital technology to use that? Can we use the digital technology to knowing our resources like hospitals, like drugs, diagnostics in that? Can we track immunization like we were doing in COVID? Yes, we can. The COVID has shown that these applications can do that. For example, a person who didn't get a second dose, we knew who the person was. Can that person be followed up so that no loss of second dose or third dose or as per required schedule happens? Another thing is very important is for India, such a large country, the same applications need to be transferred immediately to the whole country. This has been shown clearly during these times that sitting from center, we could transfer these applications in a very short time to whole of the country. Now, those types of things need to be replicated in others. Another important aspect is, which I think Dr. Shafqat also mentioned, is the logistics. How logistics can be managed. Where there is shortage, you shift from one place to another. So this digital health technology can help you in managing your resources very optimally and see that no wastage occurs. So you know how much is there, how much is left with you, how much more you need. So that gap analysis will be very important by using this technology. And I'm sure this is where we should go ahead.
So coming back to you, Dr. Khan, both of our panel members have talked about the Ayushman Bharat digital mission. Can you talk us or take our viewers through a little bit about what the Ayushman Bharat digital mission is all about, the goals or the targets for this particular mission?
Basically, Ayushman Bharat digital mission has two components. Number one is the health insurance component, which actually ensures the health of that individual. But to ensure the health of this individual, we need a robust government and a private healthcare setup. Now, if a person who is in Jammu goes and falls ill in Delhi, he obviously has to be screened, and things have to start from zero. Now, if we create a unique ID, which is across the length and breadth, the data bank has his entire credentials about the nature of the disease, the nature of the illnesses he has gone through. It'll be a versatile way of immediately taking him to the treatment straight away. And number two, when we have this unique ID created for this particular person, it will help us identify whether the disease claimed is right or wrong. It will the loopholes, it will correct the loopholes as well in between, and it will rid us of the number of problems which come in normal healthcare insurance processes. That is the proliferage and the small things which when the insurance companies back off and then they say no, we are into losses, or we cannot manage it financially. There are schemes which have failed because of improper record keeping and the data about the patients. So Ayushman Bharat digital mission envisages to digitize all the data of the patient and place it in a platform where it is accessible to any healthcare institution across the country. And so if a person from J&K goes to Kerala or to Karnataka, he will be able to get the same scheme of healthcare which he is getting, or any super specialty hospital where he goes. His entire record will be accessible. And I think to have a robust Ayushman Bharat scheme, which is universal for all and includes every kind of person with a economic background from top to bottom, or any other specified group, we will be able to ensure the life of our people. And our life of the people of this country is the most sacred thing. It's the most biggest human resource we create. And if we are a healthy nation, we will of course lead by example, which we already are, in fact.
So, Dr. Gopal, we have heard Dr. Khan share his perspective about the Ayushman Bharat digital mission from maybe a union territory or a state or a user perspective. As a partner to the central government or as a part of the central government, can you share what was the thought process behind the Ayushman Bharat digital mission and what are the kind of goalposts that the mission has set for itself?
As I mentioned in my opening remarks, that means the digital efforts were going on. When this digital mission was launched, we had envisioned that we would be having 1.3 billion records. If you look at the Clinical Establishment Act way back in 2011, it has given that each and every institution which is adhering to the clinical establishment would be maintaining these electronic health records. But as I mentioned, that is the architecture is there in the form of a digital blueprint, and the digital blueprint is rolled out as a digital mission. In this vision, what we are doing is we are digitalizing the health, digitalizing the provider, that is doctors and nurses. We are getting an ID for the institutions, as well as AHA also. That means Ayushman Bharat health accounts also can be created. Based on that, the institutions which are participating in PMJ program, that is the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, they would be using this health ID for creation of the electronic health records. The ultimate objective is that. If you look at the way things are moving, initially pilot has happened for digitalizing the health IDs of the institutions as well as the union territories. Looking at the success, an earmark budget has been given so that the digitalization exercise across all the states happens over the last in the coming 3-4 years. In that way, it is moving on. Side by side, what the digital mission is attempting, because in Ayushman Bharat program, there were two missions. One was the Pradhan Mantri Jan Arogya Yojana, the other was the health and wellness centers. The health and wellness centers caters to the preventive and the promotive care, and the secondary and the tertiary care was is given to half of the population by this PMJ program. But how is so that a continuum of care from health and wellness center to PMJ program can be envisioned. So for that also this mission, this Ayushman Bharat digital mission, that would be seeing that how this continuum of care is this. That means in a nutshell, creation of digital IDs for the hospital providers, the electronic records, this health accounts for the individuals, as well as electronic health records, so that a continuum of care is there. If you look at the other documents which we have released, that is Niti, this document, where we have envisioned that we will be using the electronic health records for disease surveillance purpose also. Apart from that, these electronic health records or the digital ID of the person, they can be used for the other services. If you look at the landscape of the health programs, you are having a malaria program, TB program, mother-child program, there are many programs are there. And you are having an IDSP program, and each of the programs is having a technological platform. For integrating that, and already the Ministry of Health is already having a developed and integrated platform, which is called Health Information Portal, in which all the other programs would be riding on that, so that a linkage is created. So in the coming days, you will be seeing you will be hearing a lot about all these things, how the integration is happening, because in the vision which I told that it is a highway in which all the integration has to happen. Because right now, technology platforms are being created, private sector, government sector, but integration has to happen somewhere. For that, the health account ID, that's the prime thing. Then the ID for all the facilities, ID for the providers, if they are there, you can have many activities which can be used for the program implementation of the things.
So Dr. Gopal, you have outlined this Ayushman Bharat digital mission, and it seems to be a very ambitious and a mammoth project. You also mentioned that we are looking at maybe over 1 billion records. So this brings me to the core issue of, privacy. with all of this healthcare data that is going to be integrated and kept together, how are we ensuring the security or privacy of this citizen data?
I think you can ask this question to Dr. Dhingra, as he has mentioned that he would be asking out. But nevertheless, we do have a bill which is pending in the parliament. The moment this bill comes, this will address all the privacy and other issues.
So, Dr. Dhingra, would you want to share your views about the security and privacy of this huge amount of data that's being collated?
Look, the issues are the data, which is how much data can go on public data, how much data can be at the back. There is always an issue of sharing data between medical practitioners and health practitioners. Fine, that is type of shared data that is there. For example, if I'm a doctor, I need a prescription, the other doctor gives me all details. But when you're talking about in health, in such digital platform, there is a backend which will lead to certain security systems and also the privacy maintained. So that is very important. For example, you will not get a hold of the Aadhaar card numbers of things. You will not get the details of the individual unless and until.
So, Dr. Harshvardhan, we have been discussing about the Ayushman Bharat digital mission and the various initiatives that the government is doing. Would you like to share your view about the Ayushman Bharat digital mission, and what do you see are the issues and challenges that you feel would be there?
After having been trained at All India Institute of Medical Sciences, New Delhi, and having served in the medical or healthcare industry since last 2 decades, I have seen it in the best of worlds, be it USA or a sub-center in the remote village of Basti district of the UP. What I have observed quite often that when a patient comes to a particular hospital for a particular ailment, gets treatment, goes back home, and after a while he needs some treatment for some other ailment. And likewise, along his entire life cycle or lifespan, he undergoes many cycles of treatment for many things in many different hospitals. And every time he has to begin afresh. It leads to a lot of difficulty. It is time intensive. It leads to error as well, and it adds to pocket load. So WHO, under the ambit of WAPS, World Alliance on Patient Safety, and Government of India under the umbrella of National Patient Safety Framework, and WHO again under the aegis of Global Patient Safety Action Plan, has advocated for a specific vertical by the name of medication reconciliation, wherein one element is medication reconciliation, and the larger element is the healthcare provisioning reconciliation. That means when a patient moves from one healthcare organization to other healthcare organization, he did not prepare all his demographic details, registration, ID, everything is all over again. So National Digital Health Mission of Government of India under the Ayushman Bharat ambit is a way forward. In the long run, it will help create a digital ID for every patient, and when the patient will walk.
I think we are having some link issues with Dr. Harshvardhan. So coming to you, Dr. Khan, your view about the security and privacy of healthcare data in this scheme?
You see, the entire data is supposed to be in databases of the government only. I think we have sufficient.
Actually, let me share with you, because for some, and I'm traveling, I'm commuting. Issue, so I could not actually understand what our speakers shared, the way the speakers shared their mind on the given point.
So, Dr. Harshvardhan, you are having a problem with your link. So maybe we could, schedule a session with you later. So go ahead, Dr. Khan, if you can.
So my understanding is that we all have the whatever information generation has been done on the government platforms is on the IT platform of the government only, with sufficient firewalls and sufficient privacy and settings available with us. And I think, of course, there will be a concern which may be at the national level, at the central level, wherever there is more scope of keeping, because this will be vital information. It'll be about the, it'll be very, very confidential, and not be able to, share uh, medical history of anybody to anyone in general, in totality. Nobody can peep up into your medical history. So I think enough steps will need to be taken to develop an environment of safety and security for this information, which I think people must be working in the government of India, I think in Niti Aayog, and maybe Dr. Madan is going to be laying more emphasis on the security issues, pertaining to it.
So this brings me to the last part of our discussion today. So I would like each of our panel members to share their views or thoughts on what should be the immediate priorities for the healthcare leaders as they go about this technology adoption. Maybe Dr. Dhingra, you want to go in first?
Thank you very much. I think it's very important that we understand. For example, if you see during COVID times, you used to have daily reporting of the cases. Daily reporting cases, deaths, mortality, as well as the resource availability, the beds availability, how many patients are there, how many, as well as at the same time, any major meetings being held, their outcomes being discussed. Taking it from there, I think similar things should happen, giving an idea about what is the disease status, when I say disease, I mean both communicable, non-communicable status, maybe not on a daily basis, which will overload the systems, but on a weekly, so that it gives you an idea about where the country is going. Secondly, definitely it's very important for the resource allocation, if we keep seeing there, and if we can keep getting these data up to the district level as they were being the state and district level, it will help in resource allocations. Definitely, I think I would go with the electronic health records is a need. Like Harshvardhan also said, that means if the records are there, if patient moves from one place to another, or anyone moves, his records are there and you can easily access them from it. So it will help in reducing a lot of redundancy, duplications, and errors. That will also help. Definitely, I would also say that, forecasting of disease outbreaks, forecasting of increase in diseases would be a major thing that can also be done by digital health technology. That means modeling of diseases that may happen with number of, taking multiple points of data and try to predict how the disease is going, along with the interventions that are being done. Those all will be very important in the coming days. Thank you.
Dr. Harshvardhan, would you like to share maybe your view in terms of what you feel should be the priorities of various healthcare leaders, people who are going to, who are watching this particular session? What would be your suggestion to them as to how should they prioritize this technology adoption in the healthcare system?
What I believe is we can begin with the medical colleges, medical institute, or teaching hospitals in the first go, which in turn can set forth the ball rolling for the district hospitals in the second go. In the third go, it can move on to the corporate hospitals. In the fourth go, it can go to all the major government, major private players. And in the end, it can go to the individual solo practitioners. What I mean to say, it can be rolled on in a phase-wise manner where the premier government institutes and then medical colleges and likewise can take a role gradually so that in a reasonable span of time, this every patient has got his digital ID available, and when he moves along the healthcare spectrum or healthcare organizations all across the country, he gets seamless service, notwithstanding where the point of care is.
Thank you, sir. Dr. Khan, would you like to share or suggest any priorities for the healthcare leaders?
I think I will tell you the model of J&K right now. I mean, I will the best evolved model, for the past 3 years. We had 550 medical seats available. Now we have 1150. We have 7 medical colleges just come up in a span of 3 years. Number one, we have harnessed our potential for nursing care, BSc nursing. So we are harnessing a human resource. Number two, we are wanting to, we already have, in fact, in the year 2012, mapped all the institutions, healthcare institutions, entire length and breadth. Now we are remodeling them and aligning them to our needs. We have said we don't want further infrastructure. We are not going to spend upon infrastructure. Our leadership at the top level has said we are going to look for quality. We are going to have all our hospitals accredited through NABH, NABL, the laboratories. We will keep certain benchmarks. We will have performance audits for people working in different spheres of our healthcare system. We will have an infrastructure which will be of quality, because we understand as a UT that we have during the past many years have had a number of political healthcare institutions come up. Political, you understand the word political. Political means where there is no need, there is a PHC, just because a politician wanted it. So we have been lucky to now realign our requirements as per the aerial study, geospatial study we did in J&K. We have put it on the state information platform where you can click and find the institution. You can map it. You can go to the platform and find out this sub-center and the PHC and the community health center and the super specialty hospital as well. Number one. Number two, we are mapping a GIS study of all the institutions as to how many doctors are placed there, how many beds are, what is the bed strength, what kind of treatment is being given. And as rightly said, we may have to create a horizontal and a vertical at the same time, in which we'll have to have a very robust, effective mechanism of treating patients from the first referral point, because we have seen that many people walk into a tertiary care hospital directly. That practice we'll have to make districts very strong hubs of healthcare. Go down the PHC, the healthcare wellness centers where there is preventive and promotive healthcare, available to a person. Maybe just he has a headache and he's going to a bigger hospital which he may need, he doesn't need. Maybe we'll work more on geriatric healthcare, the healthcare of the elderly who need more focused attention. So I think these are small things for our leadership, which we have already done. The bosses, our bosses at the helm of affairs have understood what the priorities are. We have fixed them, and I think we will carry them forward, and you will see J&K emerging as a model of healthcare in the entire country. You'll be surprised to know that, we had a single 10-digit fall in the infant mortality rate in 2018. 10-digit. It has not happened anywhere in the globe. You can check Google that one UT had a fall of 10. Now we are at 16. We were somewhere at 33. So we are improving in every sphere. And I think this country together, at the central leadership, what is giving us right now is the leadership required at the central level. And I think that's a very great effort to do. And we are happy that we are under that umbrella of priority, and J&K has come as a priority for the central government. And we are trying to make it a model state, model UT, and a model for the entire country to follow.
Coming finally to you, Dr. Gopal, what would your suggestions or maybe 3 or 4 priorities be for the healthcare leaders as to how should they go about approaching this technology deployment?
Importantly, one we have to understand and underline is that the practice has to be built into technology, not the vice versa. That's the first message they should understand. If you try to build technology into practice, then it takes time, because you have seen the OPDs, prescriptions in AIMS and other places, still they are struggling to implement that thing. That should not happen. See that they need to put some time in understanding what is the practice and how technology will that practice. That should be the key. Second thing is how you standardize things, because not many things have come up. Just take the example of telemedicine. lot many networks have come. We have to see that what kind of standardization can happen, because the industry can dictate the standards. What kind of standards, what kind of quality of services they are providing. If they focus on quality and standards, they are going to survive. If they are not going to provide quality and standards, then obviously they will come and go. Right now, a lot of silos up in the telemedicine field as well. If you look at the apps also, there are so many apps. It's confusing to the customer. If you are having if you have standardized thing, the industry has to decide the standards. If the government prescribes it, then the voluntarism and the innovation will be lost. The industry should come forward and decide on the standards, how to ensure quality of the things. Because quality of consultation, you can't say that which of the network is providing which quality of services. So when the digital things are improving, we have to focus more and more on setting in standards and more increasing the quality of consultation and quality of practice. These are the two things I think we should be focusing to sustain and survive in this ongoing or upcoming field of this technology and other things. Otherwise, it will be very, very difficult. The only people who will survive and sustain would be adopting the quality as well as putting in standards into practice.
Thank you, Dr. Gopal. I think we have all seen how technology, has affected every sector, and how digital transformation is happening in every sector. And I think that, the healthcare system has already seen the benefits of technology, and they would not hold back, in terms of trying to take maximum leverage of what technology can do for them. I think Dr. Gopal has summarized this beautifully when he said that, the focus should be more on standardization and the focus should be more on the practice rather than, on the technology. I think we have had a very good discussion, and on behalf of Tech Observer magazine, I would like to thank all of our distinguished panel members, Dr. Harshvardhan, Dr. Gopal, Dr. Dhingra, and Dr. Khan, for taking time out of their busy schedules and sharing their inputs with us. And I'm sure the audience has greatly benefited from their insights. So thank you once more, dear panel members.